Restoring sight in Somalia, free eye care brings hope to thousands. Mogadishu, Somalia. In a country facing decades of challenges from drought, conflict, displacement, and poverty, access to healthcare remains difficult for many Somali families. Among the most overlooked health concerns is preventable blindness and visual impairment, conditions that continue to affect thousands of people across both urban and rural communities. For many Somalis, particularly the elderly and those living in remote areas, reaching specialized eye care services is often impossible due to financial hardship, long travel distances, and limited availability of medical facilities. As a result, countless individuals live with untreated eye diseases that significantly reduce their quality of life and ability to work, learn, and care for their families. Recognizing this growing need, a group of Somali eye health professionals launched a free eye care initiative throughout 2025, aimed at providing diagnosis, treatment, surgeries, medications, and eyeglasses to vulnerable populations who would otherwise have no access to these services. The program, implemented through Medina Hospital in Mogadishu, reached approximately 2,300 beneficiaries during the year. Patients receive comprehensive eye examinations, medical treatment, cataract surgeries, and prescription eyeglasses at no cost. Healthcare providers involved in the initiative say the project was designed to remove financial barriers and ensure that sight-saving services could reach those most in need. Visual impairment affects nearly every community in Somalia. Whether in cities or rural settlements, many families have at least one member struggling with preventable blindness or severe vision loss. Our goal is to ensure that eye care becomes accessible to everyone, regardless of their ability to pay, said one of the ophthalmology professionals involved in the program. A family's journey back to sight. Among those who benefited from the initiative is Halimo, a 38-year-old mother from Mogadishu. Before receiving treatment, Halimo struggled with deteriorating vision that affected her daily activities and ability to care for her family. The free eye care campaign provided her with an opportunity she never thought possible. I had been living with eye problems for a long time, she explained. The cost of treatment was beyond what my family could afford. When I heard about the free eye care services, I immediately registered. Halimo was not alone. She brought along her 78-year-old mother and her 90-year-old aunt, both of whom had been suffering from age-related eye conditions that severely limited their vision. The three women underwent eye examinations, received treatment, and were provided with the care they needed without paying any fees. For years we thought losing vision was simply part of getting old, Halimo said. But after receiving care, we realized many of these conditions can actually be treated. This program changed our lives. She described the experience as a source of renewed independence for her elderly relatives, allowing them to move more confidently and participate once again in family and community life. 5 years in darkness. Another patient, Teacher Muse, shared an emotional story of recovery after spending nearly 5 years with severe visual impairment. According to Muse, his worsening eye condition gradually prevented him from carrying out his professional responsibilities and everyday activities. I could barely recognize faces or move around independently, he recalled. I lost much of my confidence because I depended on others for many basic tasks. Through the free eye care program, Muse underwent cataract surgery at no cost. The procedure successfully restored his sight. When the bandages were removed and I could see clearly again, it felt like I had been given a second chance at life, he said. I had spent 5 years living in darkness. Today I can read, walk independently, and engage with my students and community once again. I am deeply grateful to the doctors, nurses, and everyone who made this possible. Addressing a national challenge. Eye health specialists warn that preventable blindness remains a significant public health challenge in Somalia. Many cases are linked to cataracts, untreated infections, refractive errors requiring eyeglasses, diabetes-related eye disease, and other conditions that can often be managed or cured when treatment is available. However, healthcare access remains uneven, particularly in rural and displaced communities where specialized services are scarce. Medical professionals involved in the project emphasize that expanding community-based eye care programs is essential to reducing the burden of avoidable blindness. Sight restoration does more than improve health, one clinician explained. It restores dignity, independence, education opportunities, and economic productivity. When one person's vision is restored, the benefits extend to the entire family. Looking ahead. While the program's achievement of serving 2,300 people in 2025 represents significant progress, healthcare workers acknowledge that thousands more Somalis still require assistance. Many communities continue to face barriers to accessing essential eye care services, particularly among older adults, internally displaced populations, and families living below the poverty line. Medical teams say future efforts will focus on expanding outreach activities, increasing access to cataract surgery, distributing eyeglasses, and bringing services closer to underserved populations. For beneficiaries such as Helimo, her mother, her aunt, and teacher Muse, the impact has already been profound. Their stories illustrate how access to basic eye care can transform lives, restoring not only sight but also hope. As Somalia continues to recover from years of hardship, initiatives that bring healthcare directly to vulnerable communities are helping ensure that preventable blindness no longer remains a life sentence for thousands of people across the country.